I'm Dr. Ritesh Sharma, Director and Head of Nephrology and Kidney Transplant Medicine at Asian Institute of Medical Sciences, Faridabad. We are discussing Aisha today, who came to us for a kidney transplant from Somalia with her younger brother Abdullah, who wanted to donate his kidney to her. She had been on peritoneal dialysis for the last around 2 years and was keen on getting a transplant for a better quality of life and better health overall. So I'll let Aisha talk about her experience after the transplant and how it has changed her life. Aisha.
Thank you, Doctor. My name is Aisha. My nationality is Somalia. I came from Kuwait and I born in Kuwait. I wanted to, first of all, thank all the people trying and to let me have transplant, all my doctors, my brother Jawid and my sister Buji. It was very hard for me to do peritoneal dialysis for almost 2 years, that I just stay home, can't study, can't do anything, and I was very grateful to my God and to my doctors and my family after I discovered Asian Hospital through my brother Jawid. Thank you, my brother. And I did transplant, and a lot of changes happened to my life. Since that day, I feel comfortable. No dialysis, first of all. No any problem, no disease. I can walk, I can do my daily routines, everything. And I will try my best to bring all the patients that have in same condition with me, with my doctors. Thank you, my Dr. Ritesh, thank you, my Dr. Fikas, for helping me to go a new life and a new situation in my life. And thank you, my brother, who donated for me. He's almost bigger than him, 2 years. Abdullah himself.
Yes, really. Abdullah should also speak. He has given the kidney to his sister, and how does he feel?
Really, I'm feeling proud of helping my sister to succeed in her life. Because I remember before 2 years, she used to call me when she was crying. Well, I don't know what I'm going to do. And also I'm thankful to all my doctors and all.
And how do you feel physically after donating the kidney and the surgery?
I'm feeling normal.
You're feeling normal?
Even yesterday I was working for 4 hours.
4 hours you walk, and this is just not even 2 weeks after the surgery.
Yeah. And I'm feeling well. So I'm thanking also.
So that's another point to highlight, that people who donate their kidneys stay healthy and they can lead a normal life as they were even before the surgery.
Even they can marry after 10 days immediately. So
yeah, but you have to study first before you get married.
No, I'm not talking about myself.
So overall, this remains the best modality of kidney replacement. Gives you a better quality of life, better health overall, better longevity of life as compared to dialysis. And when we look at the cost of treatment overall in the long term, transplant scores over dialysis in every which way. In talking about terms, when patients end up spending, say in US dollars, 90,000 US dollars on dialysis every year, they spend roughly $30,000 on a transplant. So the cost of transplant is 1/3 that of dialysis when we look at it on a yearly basis. So it's not only the best treatment, it's also one of the most cost-effective treatments for kidney failure.
Myself, Dr. Vikas Agrawal, Senior Consultant Urology and Head Kidney Transplant at Asian Hospital, Faridabad. Aisha, we did the kidney transplant, and her brother Abdullah came forward as a voluntary kidney donor. After massive workup of kidney transplant and legal workup, we operated on Aisha and Abdullah. Abdullah, the kidney operated was by the laparoscopic technique, in which we make 3 to 4 small holes on the abdomen, and through which we mobilize the kidney, and by a small incision we remove the kidney, and after the removal of the kidney we transplant into the Aisha, and on the same time, after the anastomosis, the artery and the vein, the urine start on the kidney, and patient improving overall its status. After that, there is no requirement of any dialysis, and you can see the Abdullah, who has been right now only 10 days after the transplant, is doing very good, and he is doing all his routine work, and he feel even with a single kidney, the message of donation, of kidney donation, is that you can survive very well on one kidney. And with latest technology of laparoscopy, the donation of kidney is becoming very easy, and patient cosmetically and physically is very better. And for the recipient who received the kidney, they immediately started producing the urine, and they can live their life as normal as they were before. So they feel like that they have done